Skin cancer is the most common form of cancer in the United States. More than 2 million people are diagnosed annually, meaning 1 in 5 will develop skin cancer in their lifetime. Thankfully, skin cancer is curable. We have a wide variety of successful treatment options. One such option is Mohs surgery, which is the most effective technique for removing basal cell and squamous cell carcinoma.
It's a highly specialized technique usually utilized for basal and squamous cell cancers that occur in cosmetically or functionally sensitive areas, such as tumors that occur on the face, lips, nose, eyelids, ears, fingers, or digits, and also for tumors that have failed other treatments, tumors that have very highly aggressive microscopic features, or in patients who have underlying immunosuppression or underlying problems in fighting the cancer cells.
Basal cell and squamous cell cancers have a unique structure. These cancers typically grow as one continuous mass of cells, similar to a plant or tree with roots that grow underneath the soil. These roots are not visible to the naked eye, so we can't see how much tissue we have to excise in order to completely remove the roots. That's why we need to use a tissue-sparing technique, such as Mohs surgery.
A very small margin is chosen and incised around what appears to be the edges of the tumor. It's removed surgically. It takes about 3 or 4 minutes to do. And then at that point, the specimen that is removed is analyzed under the microscope to make sure that the roots are completely excised. The lab work is done in the office. The patient usually waits about 45 minutes to an hour. And during the lab work, a histotechnologist is taking very, very thin slices from the edges of the tumor excision and then staining the tissue on a microscope slide so the surgeon can then analyze the margins. The surgeon essentially acts as surgeon and pathologist in that we are able to determine whether or not there are more roots left in the wound or whether the roots are completely excised.
If we find that all the roots are removed, the procedure is essentially finished and the cancer is considered cured. If, however, there are still roots that we see at the tumor edges, that means that we haven't fully excised all of the cancer. We then use a mapping system to know precisely where the tumor roots still remain. We return to the patient to take a wider or deeper incision and then retest the specimen in the lab again. We do this until we are certain that all the abnormal cells have been removed.
After the procedure is performed, we have the confidence knowing that the surgical wound can be reconstructed with the comfort that the tumor cells and tumor roots are removed. And usually the reconstruction is either performed by the Mohs surgeon, who then acts as reconstructive surgeon, or in some instances a plastic surgeon for those wounds that are larger or occur in very cosmetically sensitive areas. Mohs micrographic surgery, in summary, is a very highly specialized and effective technique for certain types of skin cancers, leading to recurrence rates less than 1%.
The patient's activity following the procedure is variable depending on the type and location of the tumor. Some patients with small tumors can return to regular activity the next day. Whenever a patient returns to their life, they can do so feeling confident. Mohs surgery provides the most cosmetically favorable results in addition to its unparalleled cure rate. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.